Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cone biopsy. Introduction. Cervical cancer is one of the most common types of cancer among women around the world. Thanks to a procedure called Pap smear test, many early stages of cervical cancer can be detected and treated. If cancer is present, the gynecologist may recommend a cone biopsy to take more tissue from the cervix in order to confirm what stage the cancer is in or to treat it in the early stages. Your doctor may recommend that you have a cone biopsy. If your doctor recommends a cone biopsy for you, it is your decision whether to have the procedure or not. This patient education program will help you better understand the benefits and risks of cone biopsy. Anatomy. The female reproductive organs include the vagina, uterus, fallopian tubes, and ovaries. These organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. 1. The production of specialized hormones such as estrogen and progesterone. 2. Ovulation, which is the release of eggs needed for reproduction. Estrogen and progesterone prepare the inner lining of the uterus in case a pregnancy takes place. These hormones also regulate when the eggs get released. When an egg is released, it goes down the fallopian tube where it may or may not get fertilized by sperm. If it is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body during the menstrual period. The uterus is pear-shaped and about 3 inches long. The lowest part of the uterus is called the cervix. It opens into the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. Diseases of the cervix. Some sexually transmitted diseases are associated with cancer of the cervix, also called cervical cancer. Since the cervix comes in contact with semen during unprotected heterosexual sex, it can become infected with sexually transmitted diseases. Cervical cancer usually develops gradually. At first, the cells that line the cervix become slightly abnormal. This is called atypia. After a while, atypia could turn into cancer. In the early stages of cervical cancer, the cancer is only on the surface of the cervix. This is called carcinoma in situ. If not treated, the cancer will spread deeper into the cervix. From there, it could spread to other organs. Treating atypia and carcinoma in situ is very successful in curing cervical cancer. The Pap smear test is necessary in order to discover atypia early. It is named after the doctor who made it popular, Dr. Papanicolaou. During a Pap smear test, a specimen is taken from the cervix using a swab or smear. Then the specimen is sent to a lab to be analyzed. HPV vaccination has been shown to prevent infection with certain strains of the sexually transmitted human papillomavirus, or HPV. This virus is the leading cause of cervical cancer, so vaccination can help prevent cervical cancer. But getting vaccinated cannot treat HPV if you already have it, and it cannot treat or cure cancer. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Cone biopsy.
During a cone biopsy, some or all of the diseased part of the cervix is taken out. The part of the cervix taken out during a cone biopsy is shaped like a small cone.
A cone biopsy can be done under general anesthesia using spinal anesthesia or with an epidural. The procedure will take place in a hospital or outpatient surgery center. Anesthesia keeps you from feeling pain during the procedure. General anesthesia puts you to sleep. If you receive spinal or epidural anesthesia, you will stay awake. The procedure takes, on average, 15 to 20 minutes. The patient's legs are placed in stirrups after being given anesthesia. An instrument called a speculum is then gently inserted into the vagina to keep it open, while the gynecologist removes the abnormal cells with a surgical scalpel or laser. The surgeon then stops any bleeding. The speculum is taken out, and the patient is taken to the recovery room.
After a cone biopsy, the tissue taken out is sent to a lab to be checked for cancer and what stage it may be in. In early stages, a cone biopsy may be able to cure the cancer. In other cases, further treatment may be necessary. Risks and complications. Cone biopsy is a very safe procedure. Its risks and complications are extremely rare. Knowing about them will help you detect them early in case they happen.
Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs.
Other risks and complications related to any surgical procedure include bleeding and infection or scarring of the cervix. These are rare. Scarring may make it more difficult to interpret future pap smears. There is the very remote possibility that a cone biopsy may make it more difficult to become pregnant or cause problems with pregnancy. This is possible if a big part of the cervix is taken out during the cone biopsy. After the procedure. After the cone biopsy, you will be taken to a recovery room. After you wake up from general anesthesia, you will be able to go home the same day. The cervix needs time to heal. Therefore, you should refrain from sex and not place anything in the vagina for several weeks. You may feel cramping and will have some bloody discharge. If the discharge becomes bright red, very heavy or foul-smelling, you should call your doctor because these may be signs of internal bleeding or infection. You should not do heavy exercise for a few days after the procedure. Showers are okay, but whirlpools, prolonged tub baths, and saunas are not recommended. Your gynecologist will tell you when these are safe. Your gynecologist will also tell you when it is safe to have vaginal intercourse, use a tampon inside the vagina, and douche.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cone biopsy is a very safe procedure that can help doctors diagnose cervical cancer and may cure it in early stages. Cone biopsy is well tolerated with relatively little pain or discomfort.
Thank you for using Explain.